Ovarian cancer is a type of cancer that starts in the ovaries, which are two small almond-shaped organs sitting on either side of your uterus. Your ovaries have two vital roles in your body. They produce the eggs needed for reproduction and create important hormones like estrogen that keep your body in balance. Ovarian cancer occurs when something goes wrong with the normal cells in the ovaries, so they begin to change and multiply uncontrollably, forming tumors that can spread to other parts of the body. Ovarian cancer can actually start in several different areas: the ovaries themselves, the fallopian tubes, or the peritoneum, which is the tissue lining your abdominal cavity. What makes ovarian cancer particularly tricky is its location. The ovaries are deep in the pelvis, so early tumors don't press against sensitive structures or cause obvious changes. So, these tumors can grow silently for years, and by the time symptoms appear, the cancer may have already advanced. This is why it is known as the silent killer, as many women do not realize they have the disease until it has spread beyond the ovaries. That's why knowledge is very important here. Understanding the early warning signs can help you stay ahead of this disease. Types of ovarian cancer. Ovarian cancer is not a single disease, but rather a group of cancers that start in different parts of the ovary. There are three main types, categorized based on the cells they originate from. Number 1. Epithelial ovarian cancer. This is the most common type, making up about 90% of cases. It begins in the thin layer of cells covering the ovary. Within this category, there are several subtypes, including serous carcinoma, the most common and aggressive form, clear cell carcinoma, and endometrioid carcinoma. Number 2. Germ cell ovarian cancer. This type is much rarer, and it develops in the cells that produce eggs. It typically affects younger women, including teenagers and those in their 20s, and has a better prognosis compared to epithelial ovarian cancer. Some of the most common germ cell tumors include dysgerminomas and yolk sac tumors, which tend to be highly treatable, even in advanced stages. Number 3. Stromal ovarian cancer. This type originates from the cells responsible for producing hormones in the ovaries. It is less common, accounting for about 7% of cases, but often diagnosed at an earlier stage because it can cause hormonal imbalances, leading to symptoms like abnormal bleeding and early signs of puberty in young girls or postmenopausal women. The most well-known stromal tumors include granulosa cell tumors and Sertoli-Leydig cell tumors, which often have a slower progression compared to other ovarian cancers. Symptoms of ovarian cancer. The symptoms of ovarian cancer can be particularly challenging to recognize because they often appear as everyday discomforts. Imagine your body is trying to whisper important messages to you. That's why doctors sometimes call ovarian cancer the whisper's disease. Let's walk you through how these symptoms typically develop and what they feel like. Early on, you might notice your belly feeling bloated, but not the kind of bloating that comes and goes with your menstrual cycle or after a big meal. This bloating persists day after day and might make your clothes feel tight around your waist. You might find yourself feeling full after eating just a small amount of food, almost as if your stomach has suddenly shrunk. Some women describe a dull, persistent ache or pressure in their pelvis or lower abdomen, not sharp pain, but a discomfort that just doesn't go away. Changes in bathroom habits are another crucial sign. You might notice yourself rushing to the bathroom more often, feeling an urgent need to urinate even when your bladder isn't full. Your bowel habits might change too. Some women experience constipation, while others have looser stools than usual. As the disease progresses, these symptoms often become more noticeable and persistent. You might start feeling unusually tired, the kind of fatigue that doesn't improve with rest. Some women experience back pain that can't be explained by physical activity or injury. If you're still having periods, you might notice changes in your menstrual pattern. Unexplained weight loss can occur, even when you're not trying to lose weight. Intimacy might become uncomfortable, with pain during intercourse becoming a concern. What makes these symptoms particularly important to pay attention to is their pattern. Unlike many benign conditions where symptoms come and go, ovarian cancer symptoms typically occur almost daily, feel more severe than usual, don't go away with normal remedies, and they get worse over time. For example, while it's normal to feel bloated after eating certain foods or during your period, the The bloating associated with ovarian cancer typically doesn't go away and might get progressively worse. The same goes for other symptoms. They tend to persist and intensify rather than fluctuate or improve with time. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Causes of ovarian cancer. Ovarian cancer develops when genetic mutations cause cells in the ovaries to grow uncontrollably and form tumors. The exact reason why these mutations occur is not always clear, but we know certain factors can increase the risk. Age plays a role. Most cases occur in women over 50, particularly after menopause. Genetics also play a big role. Inherited mutations in genes like BRCA1 and BRCA2, best known for their link to breast cancer, significantly raise ovarian cancer risk. Women with Lynch syndrome, a hereditary condition tied to colorectal and endometrial cancers, are also more vulnerable. Family history matters here too. Having a mother, sister, or daughter with ovarian cancer doubles your risk. Other than that, never having been pregnant or having your first pregnancy after age 35 can increase your risk, while multiple pregnancies and breastfeeding seem to offer some protection. Interestingly, women who've used oral contraceptives for several years typically have a lower risk of developing ovarian cancer, as do women who've had their tubes tied or undergone hysterectomy. Hormone replacement therapy, particularly long-term use of estrogen-only therapy after menopause, has been linked to an increased risk of ovarian cancer. The longer a woman takes hormone therapy, the greater the potential risk. Endometriosis, a condition where uterine tissue grows outside the uterus, has also been linked to certain types of ovarian cancer. Lifestyle and environmental factors may contribute as well. Obesity and high-fat diets have been associated with a higher incidence of ovarian cancer, as excess fat tissue can increase estrogen levels, potentially stimulating cancer growth. Additionally, exposure to certain environmental toxins, such as asbestos or talcum powder, has been suggested as a possible risk factor, although the evidence is still inconclusive. Diagnosis of ovarian cancer. Diagnosing ovarian cancer often involves several steps and tests, as no single test can definitively diagnose this cancer. The process typically begins with a thorough physical examination and detailed medical history. Your doctor will perform a pelvic exam to feel for any abnormal changes in your ovaries or surrounding areas. Blood tests play a crucial role, particularly checking for elevated levels of CA-125, which is a protein that can be elevated in ovarian cancer. However, it isn't foolproof, as it can rise due to non-cancerous conditions like endometriosis or even menstruation. Imaging tests are essential for getting a closer look at the ovaries and surrounding tissues. Transvaginal ultrasound often comes first, providing detailed images of the reproductive organs. CT scans help determine if the cancer has spread beyond the ovaries, while MRI scans might be used for more detailed images of suspicious areas. If a suspicious mass is found, a biopsy is required for confirmation. This involves removing a small tissue sample from the ovary and examining it under a microscope to determine whether cancer cells are present. In many cases, a laparoscopy or exploratory surgery may be performed to collect tissue samples and assess the extent of the disease. Treatment for ovarian cancer. Treating ovarian cancer depends on the type, stage, and your overall health. Here are treatment approaches available. Number 1. Surgery. This is typically the first line of treatment for ovarian cancer. The extent of surgery depends on how far the cancer has spread and whether you want to preserve fertility if you're young and the cancer is caught early. For early-stage cancers, this might involve removing one ovary and fallopian tube. In advanced cases, the surgery usually involves removing both ovaries, fallopian tubes, and the uterus, called a total hysterectomy with bilateral salpingo-oophorectomy. The surgeon will also remove the omen, which is fatty tissue in the abdomen, and any visible cancer tissue. The more tumor tissue removed, the better chemotherapy works later. Recovery takes weeks, and menopause symptoms can arise if both ovaries are removed. Number 2. Chemotherapy. Chemotherapy usually follows surgery and involves using powerful drugs to kill cancer cells throughout the body. The standard approach typically includes a combination of platinum-based drugs, like carboplatin, and taxanes, like paclitaxel. These medications are usually given through an IV every 3 to 4 weeks for about 6 cycles. Some patients might receive intraperitoneal chemotherapy, where the drugs are delivered directly into the abdominal cavity. While chemotherapy can be effective, it does come with side effects like fatigue, nausea, hair loss, and increased risk of infection. Number 3. Targeted therapy. Targeted therapy represents a newer approach to treatment, using drugs that specifically target certain changes in cancer cells. PARP inhibitors, for example, work particularly well in cancers related to BRCA mutations. These medications can help prevent cancer cells from repairing their damaged DNA, leading to their death. Bevacizumab is another targeted drug that works by blocking the growth of new blood vessels that feed tumors. These treatments often have fewer side effects than traditional chemotherapy because they're more focused on cancer cells. Number 4. Immunotherapy. This emerging treatment helps your immune system fight cancer cells. While not yet as widely used in ovarian cancer as in some other cancers, immunotherapy shows promise, particularly in combination with other treatments. These drugs work by either boosting your overall immune response or helping your immune system better recognize and attack cancer cells. Research continues to explore new immunotherapy approaches for ovarian cancer. Number 5. Hormone therapy. For certain types of ovarian cancer, particularly low-grade serous carcinomas and stromal tumors, hormone therapy might be an option. These treatments work by blocking or lowering certain hormones that can fuel cancer growth. While not as commonly used as other treatments, hormone therapy can be effective in specific situations and often has fewer side effects than chemotherapy. Screening and prevention. While there's no guaranteed way to prevent ovarian cancer, certain strategies might help reduce your risk. If you have a BRCA mutation or strong family history, consider preventive surgery, removing ovaries and fallopian tubes after completing childbearing. Long-term use of birth control pills lowers risk by up to 50%. Staying at a healthy weight, avoiding tobacco, and discussing hormone therapy risks with your doctor also help. As for screening, regular gynecologic checkups can help catch any changes early. So, if you experience persistent bloating, abdominal pain, changes in bathroom habits, or other concerning symptoms that last for more than a few weeks, it's important to see your doctor. While these symptoms don't necessarily mean you have ovarian cancer, early detection gives you the best chance for successful treatment. At the end, while ovarian cancer can be a frightening diagnosis, understanding the disease and its treatment options can help you make informed decisions about your care. Now we want to hear from you. Have you or someone you know been affected by ovarian cancer? What were the first signs you noticed, and how was the diagnosis made? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.